Hey guys, Dr. Brandon Schreiner here. I want to walk you through how to do home care correctly, how to use our stuff in the office correctly. I get a lot of questions. Hey, I don't know if I'm doing this right. Come with me and we're going to walk through this. So number one, our neck traction. So at home, make sure that you get a sturdy door to throw your neck traction over because it's very, very important that it's strong. Another thing that I'll say is that if you don't have a sturdy door, go to Lowe's and get something that you can actually put out of the wall that will begin to create some type of a distance so you're not hugging your door, okay? Now, some things not to do when it comes to neck traction. Number one, you're gonna come in here, and the biggest mistake that I see is this. That is what not to do, okay? What we're gonna do is we're gonna stay on our heels, right? So just like I do a squat, and I'm in this position, I'm going to be on my heels, my butt's gonna come back, I'm gonna go straight down. So I come in, it's gonna be around the middle of my neck. I'm gonna be in a good position, palms up. I'm gonna drop straight down and back up, back up. Now, another question I get is that how hard should I go? I go actually rather hard, meaning that sometimes I'll actually feel some of those joints releasing, and you'll feel a click or a pop. That's actually a good thing. That means that you're breaking up some of that scar tissue and you're getting those muscles in that spine moving, right? So don't be afraid to be aggressive with this because you're not going to fall over. Come with me. Now we're going to get into some wobbling. So this is probably the biggest thing that I see when it comes to wobbling is this. So do me a favor, put your cell phones down, put them on silent, watch some amazing education and stay engaged with our community while you're doing your wobble. So the first exercise that I'm going to have you do is just front to back, right? So one of the biggest things that I find with this is that we're moving our whole body like this instead of actually our hips. So I want to make a C, stick our belly button out, and then pull our belly button back in. And we're going to work on this back and forth until it gets warmed up, until I can increase the speed, right? So I don't want to be this way. I don't want to do this. This is not full range of motion. So I want to work on getting full range of motion, putting a big curve into my low back, and then taking that curve out. What that's going to do, and why the wobble is so important, is it helps pump nutrients and water into your disc spaces. Your discs are what holds your spine and the cushions of your spine. And so when you do these exercises, it really helps to pump all that fluid back into the joint, and it actually helps to increase those feel-good fibers and decrease those pain fibers that go to your brain. The next one we're going to do is side to side. So I want to go here. My head's going to go to one side, my hips are going to go the other. I start out nice and slow, and then I'll gradually speed it up. This is not what I want you to do. This does nothing, right? Full range of motion this way. If I want more of a stretch, hands above the head, I get a nice big stretch in through my lats and all the way down my spine. The last one that we're going to do is rotation. So if your back is hurting, if you've got some disc issues, and our doctors know about that, really take it easy on this because this can really begin to agitate it. So I want to start slow. I want to rotate my body this way and my hips to the opposite side, right? So you'll notice here that one of my feet come off the ground, and then same on the other side. Back and forth, back and forth, back and forth. 1, 2, 2, 3, 3, to however many reps that we want you to do. Here's what I don't want you to do. Okay? Just like this. This is doing nothing. I'm going to get a full range of motion with my hips and my lumbar spine. These 3 exercises are amazing, like I said, at getting all that junk and kind of knocking all the dust out of the spine from sitting and standing all day long. So come with me, and we're going to finish up with some weights. So one of the biggest things that I see patients missing is how do I put the weights on correctly? So I'm going to have Gabe be my Vanna White here. And so the biggest thing that I'll say is that we see the head weights not positioned correctly. And so the first thing that Gabe wants to do when you ever do your weights is, one, make sure that the correct amount of weights are actually in the head weight. So by pulling this back, you can see that there's the correct amount of weights, because sometimes what happens is that sometimes people will put those weights back in the wrong bin. And so don't just trust that someone's going to do that the right way. So make sure you watch that. The next thing is I want to make sure I look at the mirror and I want to make sure that the head weight is center, right? And so the head weight is center, and if you look here at the thing, Gabe, your nose is in the middle of the head weight. The other thing that I want to make sure that we understand is that when Gabe is wearing the head weight, it's just over his eyebrows, okay? The reason why this is super important is because this can affect how your head is under posture. So I don't want the head weight to be up here like this, because what that's going to do is it's going to actually cause his head to go more forward, okay? So from the side, if my head weight looks like this, it's going to actually force his head this way. The other thing I don't want is I don't want this strap to be all the way up here, okay, and down, because what that's going to do is that's going to force his head this way, and I don't want that either. So I want to make sure that the strap is just underneath the shelf of the back of your head, and then the head weight is just over his eyebrows, and that way the head weight does what it's supposed to do. That make sense? And then what we're going to do is we're going to come over, we're going to turn on our vibe plate, and when it comes to wearing a head weight, a lot of people ask me this all the time. So go ahead and step off, Gabe. What are these for, right? Whenever Gabe is wearing a head weight and you're only asked to wear a head weight, you don't need one of these. You can simply stand on the vibration plate without anything else. The reason why you're going to see people standing on these is because they've got full body weighting systems. And so the only reason why you would need to stand on a pad or one of the wobble cushions is whenever you're wearing a full body weighting system. And what this does, it creates some instability so the glutes don't lock down the weights. The last thing that I'll say about vibration is just make sure that the vibration plates are on 30. You can just simply look down at these little plates here and make sure that the dial is on 30. And then when you're done, these will turn off automatically. Those of you who are 5 minutes, you'll hit the black button. Those of you who are 2 minutes, you'll hit the red button. Most people should be at 5 minutes. So I hope this begins to clear up some of the main pieces of your traction. Remember, if you have questions, ask them before you do something wrong. These exercises are vital to retraining your brain to know what a normal posture is. And so these exercises, just like riding a bike, takes time and it takes repetition. So make sure that you're doing your home rehab consistently. If you're in your corrective phase of care, that's twice a day. If you're in maintenance or wellness care, that's once a day. Think about brushing and flossing your teeth. It's the same concept except for your spine. So, hey, I can't wait to see you guys in the office. I hope this video helps. We'll talk to you soon.